My name is Brianna Rowan. I'm a nursing student here at Chamberlain, and today I'm going to be doing my catheter insertion. Okay, before I begin, I'm going to start with some hand sanitizer. Okay, can I confirm your name and date of birth, Mr. Bear? Okay, today I'm going to be putting a catheter in you. Okay, before I begin, I'm going to take out my kit. Go. Before I begin, I will position the client's bed down to make sure they're comfortable, explain the procedure to them. Now that I have my kit open, I'm going to get all my procedures set up. I'm going to start by putting a sterile blanket down to collect any drainage from the procedure. Okay, I have my clips. Here's my container to collect the urine sample if needed. My lube for my catheter insertion, and my liquid to inflate the balloon. Okay, before I begin, I'm going to don my clean gloves. In a hospital setting, this would be a fresh pair of gloves. Okay. Get my catheter out. Set that in my sterile environment. To begin, I will pour iodine on my cotton swabs. This is a female. I will open up the labia. My iodine would have already been poured on my cotton swabs. I will take the cotton swabs with my tweezers and clean inside the labia, top to bottom, to make sure everything's clean, exposing the area. I will discard of my iodine cotton swabs in the proper area. I'm gonna get out my catheter. I now have my catheter. I would insert the balloon. Okay. I would then use the lube and explain to the client the procedure. You're gonna feel the subtle thrust. Okay. Now that I have my lube, I'm gonna insert this a couple inches deep so I see urine expel into the bag. Is that okay with you? Are you comfortable with me touching you? Okay. I'm gonna now expose the area. Take the lubricated end, stick it in. I will go in until I see urine expelling. Once I see the urine expelling, I will stick it in 1 to 2 inches deeper. To keep the catheter in place, I would now expel the catheter bag, the balloon. And once that's all the way in place, I will check to make sure everything, are you comfortable? Okay, the catheter is now in place. I would then use the leg strap to secure the catheter to the thigh. And then there's a clamp here for me to connect it to the bed. And if I was in a hospital setting, I would see urine expelling into this bag. Clamp it to the bed, to the bottom of the bed. If I needed a urine sample, I can empty this container out into the sample cup and take my urine sample. Okay. And now, Mr. Bear, your catheter is in place. Are you feeling comfortable? If the patient is comfortable, I will assess the area, make sure that there's nothing, any red, no swelling, any drainage. And at the end, I would make sure the client's bed is back positioned properly, perform hand hygiene, and that's my catheter insertion.